Hello, everyone. Today we'll be talking about managing side effects of antiretroviral medication. And just before we dive into that topic a little bit more, permit me to go down memory lane to the beginnings of the medications that were used in the management of HIV. In the early 80s, we had a single pill regimen, which was actually the first to be used to treat HIV, which was zidovudine. It really had a lot of side effects, and it wasn't extremely effective in its management. So in the 1990s, a multi-pill combination was introduced. So you could have people managing HIV taking up to 20 pills a day, at different times of the day. Of course, this was going to be inconvenient, not to talk of the myriad of side effects that would come with each of them. So the thought was to combine all of them. We had the highly active antiretroviral therapy and then combined into single pill regimens that are available today, which is more convenient and usually has lesser side effects than both the multi-pill regimen and then the earliest single pill medication available. And just to give a scope, you can see here a number of medication that can be used from different classes. So what happens generally is, depending on the stage of the HIV infection, the severity and the clinical goals that the clinician wishes to achieve, they can make a choice from either or any of these groups of medication to manage HIV effectively. Just to see here, you can see representatives of different groups like tenofovir, ritonavir, rilpivirine, as well as DTG, that's dolutegravir. So these are a number of the medications available for the treatment of, or the management rather, of HIV today. And going down the years, you can see that the severity of the side effects have generally decreased from zidovudine, which was earlier used in the management of HIV, which had really severe side effects because it was used in high dosages, given it was a single component regimen. So you had anemia, you had liver damage, heart and skeletal muscle abnormalities. But then going down the years, you can see that at today, we have really safe medication that have fewer side effects, and their side effects are lesser in their severity. And we also know these medications that are used generally to manage HIV today. The mainstay generally in many parts of sub-Saharan Africa and in much of the world generally is the dolutegravir-based regimen, which is a once daily dosing, once daily oral medication. One of the brand names of this is Acryptega, but a major side effect that's related with this is weight gain. But the effects of weight gain in adolescents have not been fully studied. So I think that's an open area of study for a number of people to look into and see the effects of dolutegravir on weight gain in adolescents. And you have the efavirenz-based regimen, which is gradually being phased away because of the highly active psychoactive side effects that you notice with efavirenz, which is the culprit in this medication. The recommendation for this is to switch to a DTG-based component, which has none of that. And then recently we've had the cabotegravir-ribavirin combination, which is giving us a once monthly injection. It's not approved in major parts of the world yet, but in Canada, it's being used now in the management of HIV. It obviously has its advantages, seeing that it's convenient, so you can have your medication once a month, but also it also has some side effects which are worthy of being mentioned, like pain, because it's an injectable, so you're going to have pain wherever the injection is given, headaches, dizziness, and the likes. So that's also good to know. But also in managing side effects, I think what's very, very necessary is to understand the severity of the side effects, as well as what to do. So if you have a mild side effects, what do you do? And if you have it's very severe or life-threatening side effects, what do you do? So the first thing is to look at them 1, 2, 3, 4, from mild to life-threatening. And obviously, when we talk about mild side effects, they are just side effects that can easily be managed. They really don't cause long-term consequences on your quality of living. So something like a rash, a mild headache, it's fairly common in the management, in the drugs used to manage HIV. Usually your prescriber or your clinician will give you something to manage that side effect. So for example, if it's a skin rash, you could get a balm that will take care of the rashing or itching. And if it's a fever, you could get an antipyretic or an anti-fever medication to manage that. For moderate side effects, I think you need to pay a lot more attention to this if you experience any of these. For example, difficulty in breathing, you're having constant nausea, vomiting, irregular heartbeats. You have to pay attention to this and report to your clinician and let them manage it. Usually what we'll say is if it becomes really, really unmanageable or very uncomfortable, your clinician will make the decision either to adjust or manage or to change the medication just so you can have these side effects reduced or eliminated completely. For severe side effects, you could have a sudden drop in blood pressure. This has to be managed immediately, as hospitalization should be done if it's noticed immediately, because it can lead to really, really unpleasant consequences. And then you have the life-threatening side effects, which are your cardiac arrest and then difficulty or total cessation in breathing. So that requires an emergency medical care. I'm just going to mention 2 points. The first is people usually ask, what do you do if you throw up after taking your HIV medication? Usually we would say if you throw up less than 2 hours after, then, because of the time it takes the body to absorb the medication, you need to take another dose, but if it's more than 2 hours, then you really don't need to, because most likely majority of the medications available today, your body would have absorbed it already. But note, never ever stop your HIV medication without letting your doctor know, and let them make that informed decision if you have to or if you don't have to. So yeah, I think understanding this and the severity of side effects, this is a perfect place for me to end my presentation, and I'm really open to having any questions or comments on this topic.